I am Dr. Suneeta Dubey. I am Head of Glaucoma Services at Dr. Shroff's Charity Eye Hospital for the last 23 years. I have done my glaucoma fellowship from Wills Eye Institute, Philadelphia, USA. What are the different classes of glaucoma medications? We have beta blockers, alpha agonists, prostaglandin analogs and CAIs or the carbonic anhydrase inhibitors as the major classes of drug, and the choice of drug depends on the efficacy of the drug, the side effects and the cost effectiveness. In Indian scenario, still the beta blockers are the most prescribed drugs. However, one should keep in mind the systemic side effects associated with the use of beta blockers. Most of the glaucoma specialists now have started advising prostaglandin analogs as the first line of therapy because of their efficacy, side effects and side effect profile, which is quite safe, and systemic safety. Prostaglandin analogs are effective 24 hours a day, and their IOP lowering efficacy is 30 to 35%, which is quite good. So the algorithm is to start the medication as monotherapy, where you can start any of these drugs, and as a glaucoma specialist I would like to start with the prostaglandin analog. However, one can also start with beta blocker or other classes, and if you are able to achieve the target intraocular pressure, then you just continue the patient with one medication. However, if you are not able to achieve the target intraocular pressure, or the pressure drug is not efficacious, then one can substitute the monotherapy with some other monotherapy, or one can add another drug to the monotherapy. If you have started with prostaglandin analog, then you can add other drug like beta blocker or brimonidine or carbonic anhydrase inhibitor, depending on the factors as I described earlier. If still the target IOP is not maintained, then you need to start the combination therapy. So one can add a combination therapy or combination drug with the monotherapy, or one can just discontinue the monotherapy and add the combination therapy. You have combination therapy available with most of the combination therapies are available with beta blocker. So there is a combination of beta blocker with prostaglandin analog, brimonidine and CAIs. However, now we have a new combination of brimonidine and CAIs, the brinzolamide. So you have, and now you can prescribe up to 4 drops in 2 bottles as combination therapy. Benefit of combination therapy is that the number of drops required is less, so the compliance is better, the side effects are less, and the dose of preservatives is also less, and so the patient is more compliant with the combination therapy. However, if even the maximum medical therapy, that is 2 bottles with 4 drops, even if this much of therapy is not adequate for the patient, or the target IOP is not maintained, then one can resort to the surgery. However, one can also doing surgery before medical therapy if the patient can't afford medication, or if the patient is not likely to be compliant, and the results of surgery are pretty good in virgin eyes. Therapy is not adequate for the patient, or the target IOP is not maintained, then one can resort to the surgery. However, one can also doing surgery before medical therapy if the patient can't afford medication or if the patient is not likely to be compliant, and the results of surgery are pretty good in virgin eyes.